Yes, we are live now. A very good afternoon to one and all. On behalf of Progressive Education Society's Modern College of Arts, Science and Commerce, Shivaji Nagar, Pune 5, and I Transform, we welcome you all for this session. The session is basically to know the opportunities in medical technology field after BSc degree. The session will be mentored by Mr. Samir Joshi. I would like to give the brief introduction about Samir Joshi, and before that, uh, I would like to mention some things related to the medical lab technology course, which is launched by Progressive Education Society's Modern College of Arts, Science and Commerce, Shivaji Nagar, Pune 5. This is the first time we are launching this course in Pune in association with iTransform. And basically, this course is a skill oriented course. Uh, this course is going to be eligible for the students who will complete their BSc in biology related subjects, that is microbiology, biotechnology, chemistry, botany, and zoology. And the students who will complete a BSc in the said courses, they will be able to take admission to this particular course. This is going to be a 1 year course, which is a postgraduate course actually. The name of this course, it is Advanced Course in Medical Laboratory Technology. The technological things related to the medical laboratory will be taught in this particular course. The details about this course are going to be mentored by Mr. Samir Joshi sir. This course is launched in Pune for the first time, as I had already mentioned, and we are very happy to mention that under the guidance of our chairman of Progressive Education Society, Honorable Professor G.R. Kote sir, the CDC chairperson, Honorable Professor Dr. Jyotsna Egbote madam, and the principal of this college, Dr. R.A. Zunzara sir, the secretary of Progressive Education Society, Professor Shamakant Deshmukh sir. Under the guidance of all these mentors, we are in a position now to launch this particular course, and we got detailed guidance and the course from all the mentors and the stalwarts that we have just mentioned. We are very much thankful to all of them. No doubt there are much efforts which are put in by Mr. Samir Joshi regarding this particular course. The idea was his idea, and we could implement this particular idea. Uh, just some details about Mr. Samir Joshi basically. Mr. Samir Joshi, he is a founder and chairman of Transcender Services Private Limited. It is known as a iTransform Group. With an engineering degree and further specialization in business management, Samir has over 25 years of work experience in local and global leadership roles before he embarked upon his entrepreneurship journey in 2007. iTransform Group attempts to address of educated unemployment. It is focused on transforming today's youth to employable workforce through their innovative industry-driven skill development programs. The group is also on forefront in driving social interventions for marginalized sections of society, that is prisoners and sex workers. Through his consistent contribution towards driving innovation and business excellence, Samir has been awarded as the most trusted CEO in May 2017, Maharashtra Startup Award 2020, National Startup Award 2022, and most prominent contributors to innovation by World Innovation Congress in February 2023. With this introduction of Mr. Samir Joshi, I now request Mr. Samir Joshi to give the brief about this particular course. Over to you, Mr. Samir Joshi.
Thank you, madam. Thank you for the apt introduction and good afternoon to one and all on the call. In fact, it is when you were talking about it as opening dialogue, Sardesai madam, I was just thinking in my mind that we are setting up this call on today, which is 18th of July, and it's just on the backdrop of where the whole world was celebrating World Youth Skills Day. So I would like to just pick up something, one point on that when the World Youth Skills Day was celebrated on 15 July, actually the objective of this World Youth Skills Day celebration is to encourage governments, educational institutions, employers, and organizations to invest in training and education and initiatives that enhances the skill of young people. And this investment is to better integrate these youth into the workforce and fostering their personal development, and finally the economic empowerment for them. So why I want to pick up this point is because I must congratulate, and I think all of us on the call should take this point, that modern college, who is at the forefront in driving quality education in Pune and around, where we are seeing there as an outcome, as a students, the way they are progressing their careers. I think a lot of accolades to the entire modern college management, the chairman, Professor Rick Bote sir, and the entire management team, that 3 days from celebrating World Youth Skills Day, I think the college is announcing none other than one of the best skill development program for the people, for the youth of this country. And I think that's the reason I thought I'll just pick up this point first. And this program, which is advanced course, which is in medical lab technology, I think that's the program what then I will now take forward as the detailing of the program. As we know, pathology as a word or as a medical branch is not new to us. Every one of us, we have interfaced some point in time in life walking into any pathology, for as simple as something what we call it as a blood test. Now, as an advanced course in medical laboratory technology, this course provides students a comprehensive understanding of all the laboratory procedures and diagnostic techniques which are essential for medical diagnosis, right? So through a right blend of theoretical knowledge and hands-on practical trainings, the students, they learn to perform a wide range of laboratory tests with precision, of course, and accuracy, that covers tests like blood test, urine analysis, microbiology, culture making, or other relevant investigations. The whole emphasis is placed on developing the proficiency in sample collection, handling, and preservation techniques to ensure the reliability and integrity of test results. Mind you, the integrity of test results is very, very important when we are talking about medical lab technology. This program will equip learners with the skills and competencies they are required to pursue rewarding careers like medical lab technologist in healthcare setting and contributing to patient care and disease diagnosis. So this is a kind of a backdrop or a background which I want to share with the people on the call, the students and the parents and the whole teaching community as well. What is the fundamental or what is the thought process of announcing this advanced course in medical lab technology? Now, before I really get into directly the program structure and outlay, I think as an aspiring candidate, the students and also their parents should know why this program in healthcare altogether, right? So I would like to stretch you back in 4 years time frame. And we know the whole world witnessed never seen before creature, which is called COVID. In fact, that compelled, and we can say today in this time frame, the way we know before Christ and after Christ as a time frame, from 2020 in this 21st century, the world has redefined BCAC as before COVID and after COVID. And that tells in a nutshell the importance of healthcare for one and all. On we truly believe, all of us, we know, indeed health is our wealth. That's the importance. This industry as a healthcare industry has emerged as a AC after COVID as a phenomena. How many of us literally were aware of even pulse oximeter, glucometer, the BP machines, etc. before COVID time? After COVID, that is in AC phase, that has become as everybody's household equipment. All of us, we are very comfortable operating those equipments, which are healthcare equipments. The emphasis when I stretch you back in this 4 years of time frame, because all of us, we have witnessed actually menace that was created by COVID, right? Oxygen cylinders were in problem. Beds availability was a problem. Medicines availability was a problem. All those physical items, if I put it that way, somehow they were brought back into the place. and the situations were brought to normal, though it took time, but they were brought to normal maybe 3 weeks, 1 month's time. However, the problem which was prevalent that time, that is availability of the skilled manpower to cater to patients. The way I introduced in the backdrop, contributing to patient care and disease diagnosis, is still a question mark in today's time. So let's talk about supply and demand when it comes to healthcare industry. There is a huge dearth of talent as a skilled workforce, which is not there in healthcare industry as a available skilled workforce. And this is where demand is quite high. So there are opportunities where the people who train themselves into those healthcare setting will have a better career development plans. And this is where I would insist that the program, which is like advanced course in medical lab technology, is available at your doorsteps at Modern College, and make use of it. Right? So let's go back to the program structure now. This course is for 1 year as a duration. This also comes under the aegis of new education policy, or the National Education Policy 2020, where course is designed into 2 semesters. So each semester is calibrated on 22 credits as per the guidelines which are issued to us. However, we have designed the program in collaboration with Modern College as a total 1200 hours of student contact hours. So that's the kind of a spread as a time. Now, the other important aspect is this is not a typical like a 3 hours and 4 hours of a college hours. This is a definitely rigorous course which is there between Monday to Saturday is a week, and at least 5 hours a day, which will go on a day-to-day basis, because we are learning now medical expertise in the lab, in the medical lab technology as a field area. The eligibility criteria, I think Madam has already suggested, but let me just touch upon that as far as eligibility is concerned, we are looking at, or the criteria has been set as minimum BSc. Of course, and that BSc can be into, be it microbiology, zoology, chemistry, botany, biotech, etc., etc. Right? So that something is the learning eligibility that this course demands for. Now, as a framework, which is 1 year, as a credit, which has 22 credit, as eligibility as a candidate, let me touch upon what are the various kind of expertise that this course is going to offer to you. And this is all in as to empower you, as skill you to work in any laboratory setting that the potential job lies. So the various topics that they cover in this program: microbiology, where we actually teach not only the basics of diagnostic medical microbiology, but it's like sterilization techniques, antibiotic sensitivity tests, various kind of microbiological tests that we study of virology, mycology, protozoology, so on and so forth. The next important topic that gets covered in this program is hematology. The basics of hematology and transfusion medicine, what we say, the blood bank techniques. I mean, there is a separate module in blood bank, but the fundamentals are taught in this program in terms of analysis and the basics of ABO, RH blood grouping, etc. RBC, WBC, platelets, RBC indices, etc., etc. So these are something are the common points which are taught as a hematology. The third next important topic that comes up the deck is the most deep dive that one has to understand when they are going to work in laboratory medicine. So that's what is, which is called as a biochemistry. Now, biochemistry is basically more related to types of glassware and instruments which are there in the biochemistry lab. But other than that, actually analyzing the different molecules, when we are talking about carbohydrates, proteins, all these are what we are talking about, vitamins, minerals, etc., etc. So these are all covered as your expertise, as a domain expertise that we are going to teach you, make you learn on biochemistry side. Additionally, the most important is the profile studies. Many of us, we have heard of this term called as LFT, RFT. Liver function test. RFT is renal function test. Lipid profile. Cholesterol. You must be aware of this word. Cardiac profiles. Male-female fertility tests. These are all covered as a part of your biochemistry expertise in this medical lab technology program. One of the finest techniques as performing these tests, analyzing the results, creating the reports becomes the responsibility of a person who is going to work in this medical lab setting. The important aspect of this program, now when we say this program as a 1 year, as a really full blown, as a very intense program, I would say there is something called as a pre-analytical laboratory testing process, and it is as simple as all of us we have seen this, as I mentioned in the before, the blood testing. The process is called as a phlebotomy. The expert who draws blood from your arm, and then that blood sample is again sent back office as a laboratory setup to do various tests and analysis to create the right reading. So this process as a phlebotomy is a part of this entire program. In fact, I'm very happy to share, when we talk about job opportunities, this just module which is taught in a months empowers you as to seek any job opportunity itself in nearby your pathology setups which are there next to your doorstep maybe. And today there is a evolution of this blood sampling is also happening, where you must have seen some boys and girls visiting homes to do the home collection, because dadajis and nanajis or nanijis etc., they can't walk into any pathology lab to give them as a blood sampling. So these path labs, they send the executives at doorstep and they do the blood sampling at home. This is called home collection. Mind you, each home collection visit pays you anywhere between rupees 350 per sample to rupees 1000, depending upon the more the critical the patient is, the higher is the charge of phlebotomy, because most intricate is the process to collect the blood without harming the patient. And that's the technique. Right? So these are something topics. There are few more which I would like to emphasize upon. The other topic are called as clinical pathology, CP. What is it called as in a short form? Now, one of the scopes in this clinical pathology is where the genesis of entire this medical lab technology lies, and that is nothing but introduction to routine urine analysis. If anybody wants to understand what is the historic kind of a chart or a evolution of this program as a medical lab technology, this is the first ability as a tech which started as a lab technology, which is routine urine. And as when the microscope get invented, the whole thing or a whole scenario moved to blood sampling and the analysis of the blood as well through microscopic. So in clinical pathology, we coach you on urine examination, stool, sputum examination, CSF, that is cerebrospinal fluid. Right? So all this as a clinical aspects of the pathology of a human structure is done in this clinical pathology as a module. The next comes as a deep dive. See how many topics, how many modalities you are going to cover when it's a 1 year medical lab technology program, empowering your skills to work in a pathology setup. The next in line is histopathology. And this is one of the most important aspects when it's a pathology. Histopathology means dealing anything related to tissue analysis, sampling, testing, processing. All of us, we have heard malignancy, cancer hai ke nahi hai, and wo bina like. So that's something which happens through this as a technique. Right? So sample assessing, grossing, basic steps in tissue processing, sectioning, frozen sections is one of the most critical skills we have when it's a histopathology. The next in line comes transfusion medicine, which in language we speak as a right. So immunohematology introduction, if I use a strong medical word there. So what is FDA has to do with that? What are the FDA regulations when somebody has to even to set up a blood bank or to work in blood bank? Guidelines which are taught. So this skill, but this is a regulatory. The people on the call and the listeners to this channel right now, the way we are on the call, whenever there is a healthcare to take care of lot of as a regulatory measure, blood bank critical aspect, because the most critical element of biology or anatomy structure of as a blood as the. So ABO and RH blood grouping by various methods, cross matching, compatibility testing. These aspects when we the blood banking or a blood transfusion. And the last but most important, which is immunology and serology. I'm sure you must have done microbiology as their BSc as a program. They must have terminologies at least. So organs of types of immunity, right? Immunoglobulins. So these are some aspects which we need to make you understand these applications, testing and done in this pathology setup. So test, Vidal test, RRR test, RPR test. We all know what is RPR now as a part of COVID, right? HBS test, HIV test, pregnancy, and everything under this as a bucket. So this empowers you to conduct various kinds of tests, their analysis, reports, which are an honest reading of the report that we are going to generate. Because this is a mirror image for now the further that patient has to go for. And this becomes a starting point for his further analysis and diagnosis. So that's the entire program outline that I thought I must share with you. What kind of program, what kind of content, what kind of topics that we are going to teach you. Structure as how this imparted. So fundamental clarity in your mind. Typically, anybody says that I'm going to program, they say I'm going to have 70% practical and 30% as a theory. Especially in medical field, it doesn't work good as such a compartmentalization. So we'll actually pass through both the things hand in hand. However, bucket by bucket, the theory goes tapering down and practical will come up as you're more engagement. But still, you will be there on some theory inputs as you're brushing up the knowledge and the fundamentals. So there are three aspects when we talk about practical knowledge now. So first bucket in practical is observership. In medical, it's a fundamental or a cardinal rule. No one touches anything unless they get some expertise to do anything in that pathology setup. So in initial phase of practical aspect of learning, observership implies what I study in the classroom, I'm going to observe in the practical setup, which is a lab setup or a hospital setup. So it's only watch and improve your knowledge. No touch anywhere. That's first practical. Just observe what is being told and what is being done. So it could be process, it could be protocols, it could be testing, it could be analysis, sampling, anything and everything. Just watch, observe, and observe. The second phase when it comes to practical is what we call it as a on-the-job training. Means what? What I study in the classroom as a theory sessions, what I'm seeing by just in the observership phase, work in some domain under somebody, so with supervision. And that is called as on-the-job training or a hands-on training. That comes as a phase 2 in your practical training at our iTransform Modern College Medical Lab Technology program. And third and the final stage of practical is your actual internship. In medical field, in medical graduation programs, internship is a very commonly used terminology. And that's something how it implies as a learning process. What I see, what I learn in the classroom, what I have seen in my observation phase, what I have worked with someone in my on-the-job phase, now can I work independently with least supervision? And that is what is called as internship, making you just close to your job readiness. And that's the last padav in your training modules. So if it's a year of program, those last 3 months will be typically in your internship phase months. But mind you, in that internship also, you will have always some online mechanism, because in again AC after COVID, all of us, we have become expert in taking online education. So we want to have that online facility for brushing up your again fundamentals, which is a classroom fundamentals, right? So that's how the program is divided to give you the best of the skilling abilities, the skilling outcome. And that's why it will not be necessarily only in the four walls of the classroom as a coaching through the year. The college is affiliated with various hospitals. We are taking various affiliations in prominent hospitals from Pune city, and you will be placed in those hospitals for your hands-on training. Now, natural question comes to your mind, especially you are proud graduates from a Bachelor of Science as a degree, right? And it's a really credit to you, because learning a pure science and taking those painstaking practicals in the colleges is not an easy job. But you are almost made yourself ready as a platform setting, because when it's a medical field, the tenacity is one of the domain expertise you need to have as your life skills. Don't get tired when it's a medical field of working. And it's enjoyable also. In world, there are only two main noble professions. One is education, being teacher or a mentor. And second is healthcare expert, where you are helping lives to be saved. Right? So if you are into this noble profession, just think that it's going to be not a typical 9-to-5 job kind of activity, but it's a well-satisfying, well-paid job as well. So naturally question comes, you being graduate, that's the point which I wanted to take up. Sir, what next then? So what next? So there are three opportunities you can have as a career progression. One is, of course, with the kind of skill through this program, you are getting job ready, and you can do job in any lab setup or hospitals or so-called diagnostic centers. So job opportunities, that is one. You can be in the job. Second, by having this as a basic qualification, one can doing something as a higher education programs in hospital administrations or hospital management or public health management. These are all higher education facilities or programs which are available, which otherwise become little tough as you just pass out BSc and get into these programs. Because normally the get crash is being done on those programs is only through medical graduates. But today, we in our institute has got case studies where a BSc guy has done Masters in Hospital Administration and is now working in companies like Deloitte, companies like PwC, PricewaterhouseCoopers as healthcare consultants. So post-graduation in hospital management, hospital administration. Why I'm saying this? Because today, if you see the trend of hospitals, even hospital segments are undergoing corporatization. So it is not only which is run by doctors and nurses, but they always need a lot of general administrative roles and responsibilities. So these are the higher education programs. The second aspect on a higher education, I would say, or a third bucket as a career progression, why not overseas? Today, in our programs, we have success stories where our students are pursuing their master's or in oncology, specialty, etc., in institutions like Greenwich, which is in UK. So these are some aspects which I would insist. Some students who have done a specialization further in histopathology is getting a handful of as a salary job in one of the best histopathology centers. Histopathology is a very specific, highly specialized skill where you can get yourself as a specialized program for this program. So what I'm trying to say and trying to share with you all is, to the students and to the parents, this program will open up doors for various other progression in your career. It could be jobs, it could be post-graduation within, or it could be a global movement to any of your destined universities, your choice. And this is where they will make you ready for the program. I think that's what is I have to share with you right now as a part of this entire program curriculum. If somebody asks us what are the fees, etc., for this program, so for that, maybe it is good that you can visit Modern College website rather. The forms, the Google forms are there on the website and can start doing registrations. There are only 30 seats for this program, and the program is open for any graduates from any colleges who are BSc graduates. And this is going to get filled up because we are just opening up the channels today. This is an inaugural session for announcing that this program on the backdrop of World Youth Skills Day is available from Modern College. and is open to all BSc graduates from all the colleges. It's not only from Modern College necessarily, but I am sure there will be rush from Modern College as alumni for sure. So those who are from other colleges, please hit the website of Modern College, look out for Google form and just submit the Google form so that you get connected with us, our teams here, and then the admission process can be explained in detail. So contact person is Dr. Shilpa Muzumdar, who is HOD of Microbiology, Modern College. So you can look out for her name. If somebody wants to walk into Modern College, please ask for Muzumdar Madam, who is HOD, Head of the Department for Microbiology at Modern College. And then the interaction can start. Mind you, this is not a typical program of 60 seats and 80 seats. For the whole of Pune city, they are opened up only 30 seats and they will be filled up, I'm sure, the way the college is running other programs. So you better look at this as an opportunity to shape your further careers, to shape in the most demanding, in most rewarding industry, which is the healthcare industry. And that is something which is very critical. So with this, I think, Sardesai Madam, I stop here and sign off for the day. And if any questions, please, I'll be happy to take any questions which are seen in the chat box.
Yes, sir. It was indeed very detailed and brief introduction about the course. I am very sure that the candidates, they must have might have received the great knowledge about the course and about the opportunities those students will be getting after attending this particular course. Now I request respected principal Dr. R.S. Zunzarao sir to give his opinion, his thoughts about the course and the college itself. Over to Narayan sir.
Honorable Shri Samir Joshi, Vice Principals of our college, Heads of the departments, teaching staff members of the college, and dear students, present students and past students of the college present in this particular meeting. I wish to congratulate you all for attending this particular session in which you have learned about importance of skills in the areas of medical technology and the job opportunities available in the field. As you know now, dear students, those who have completed graduation in science faculty, they are eligible for doing this particular 1 year course, which is called advanced course in medical laboratory technology. You might be thinking, if it is of 1 year, why it is not called diploma? This terminology, postgraduate diploma in, for example, postgraduate diploma in medical laboratory technology. This terminology has been changed when NEP, National Policy 2020 implementation has started. As per NEP Policy 2020, graduation student, when completes first year, able to award certificate of that particular, for example, certificate in science. When the student completes 2 years of 3 graduation program, then he can be awarded diploma in science. When he completes 3 years successfully, he is awarded degree. So now the diploma course, diploma term as per NEP is used for those students who have completed 2 years of graduation. And therefore, in the terminology of this particular course, it is not expected to call it as postgraduate diploma. Basically, it is a postgraduate diploma in medical laboratory technology. However, the it is an advanced course in medical laboratory technology. We have discussed about this particular course in detail with the experts. What I have understood is really it is skill oriented course. Some corporate hospitals are associated as far as implementation of this particular course is concerned. So students completing theory part or for few months exclusively practicals will be going directly to the selected corporate hospitals with whom we have MOUs, and students will get an opportunity to practically use the equipment and learn through learning. They will learn through the guidance also, but they will gain the expertise in using different medical technology related equipment. uh, since it is a full-time course, it is expected that students who have completed their graduation, particularly in science, if they decide to join this particular advanced course in medical laboratory technology, and if they decide to commit themselves for 1 year, then definitely, dear students, you will acquire the skills which are required in hospitals. Now, hospital industry term is used. It is also acceptable term. Very good services, quality service given to the needy patients, and where really trained manpower is working. So, dear students, if you decide to join this particular course after your graduation, then you will definitely learn several things and acquire the skills about medical laboratory technology. And I am sure the students of our college who have completed their graduation in science and their friends from other colleges also, they will think of joining this particular course. Our 6 departments are involved. Our facilities are also really advanced as far as practical expertise is concerned. MOUs are being signed with some corporate hospitals where the students of this particular advanced course in medical laboratory technology will be going, and whole day they will be working there and acquiring the knowledge. Our education system so far, traditional education system, has been blamed for one thing, that you give theoretical knowledge to the students, you have practicals also, but truly expertise in various kinds of skills are lacking. Dear student, this is an opportunity where college in association with some bodies, with the MOUs signed with corporate hospitals, think it is a very good blend of the situation where students can practical expertise and lead to the jobs they will be getting. So it is truly employability enhancing course. It is truly a course which provides, which enables the students to and thereby the jobs. So I am sure the guidance which you have got through the earlier session and through my appeal, you will be convinced that this particular course, advanced course in medical laboratory technology, is going to be very useful to the students in job point of view. As far as approval from university is concerned, maybe the expert has already shared that we have already applied to Savitribai Phule Pune University. The Academic Council of Savitribai Phule Pune University has approved this particular course for starting in the colleges like Modern College. Within next few weeks of time, letter from university is awaited, but I am sure we will be getting sanction. But remember, dear students, skills, even if it is a college and you get good skills, then not bother about whether you have approved a degree or you have approved a course. But I am sure uh, we will be getting a sanction from. So I express my best wishes for all the students with respect to this particular course on behalf of Progressive Education Society's Modern College of
Thank you, respected Dr. Principal R.S. Zunzarao, sir, for the inputs you have given about this course. And as appealed by respected Principal, sir, we appeal to the students to enroll for this skill-oriented course and get the practical knowledge related to this course. On behalf of Progressive Education Society's Modern College of Arts, Science and Commerce, Shivajinagar, Pune 5, we thank uh, Honorable Professor Dr. G.R. Repote, sir, Chairman of Progressive Education Society, for taking initiative to encourage us to start this particular course and following up part. We thank Honorable Professor Dr. Madam, as the CDC chairperson of Modern College Shivajinagar Pune 5, for all the guidance she has given. We thank the Secretary of Progressive Education Society, Professor Mukh sir, for the guidance and motivation that and the keen interest he has taken to the starting procedure. We thank Mr. San, who is the lead in all the initiatives those have been taken to start this particular course and to follow up with minute details related to the implementation part. We thank Dr. Shilpa Muzumdar, madam, who is head of the Department of Microbiology and who is the Vice Principal of Research in Modern College. She will be presenting this particular course in under the Department of Microbiology. We thank her also for the inputs she is giving and the and the pains that she is taking to start to for the advertisement, for the promotion, and for the making available all the infrastructure and all for this particular course. We thank all the vice principals. We thank all the staff members of Modern College, all the heads of the departments of Modern College for attending this particular meeting. We once again appreciate that all the students who have attended this particular meeting. We thank you and we wish you all the best to take the admission to this particular course. With the permission of the chair, we conclude this session. Thank you so much.